So, hey everybody, I'm Zatisha, and I'm going to be talking to y'all about Achilles tendon rupture. The objectives for this presentation is just to provide a clear understanding of Achilles tendon rupture. We'll go through its causes, clinical symptoms, functional limitations, special testing measures, differential diagnosis, the rehabilitation process, and some expected outcomes. And hopefully at the end, you just have a comprehensive overview of the condition. The Achilles tendon, as you know, the Achilles tendon is the largest, thickest, and strongest tendon in the body. It connects the calf muscles, which we know are the gastroc and the soleus, to the calcaneus or the heel bone, allowing us to perform plantar flexion or position the foot downwards, which is essential for activities like walking, running, jumping. And then its unique structure is a 90-degree fiber twist, which increases the elasticity and energy absorption, making it strong but also vulnerable for injury under extreme stress. And then this is just an image showing that. Okay, so basically an Achilles tendon rupture is just a partial or complete tear of the tendon. It often occurs suddenly. It's particularly common in sports and affects people aged 30 to 50, occurring in men, more often in men than women. Annually, around 7 in 100,000 people experience this injury, which is the rate rising for athletes to 15 to 25 in 100, which don't seem like a lot, but when you think about a billion people being in the United States alone, it's pretty common. Okay, so some of the pathomechanics for Achilles tendon rupture is direct trauma, which is just external force impacting the Achilles tendon, aging due to naturally losing elasticity, and then engagement in high-impact recreational sports, which involves rapid stops, starts, or jumping, such as basketball, soccer, tennis. Obesity can also increase stress on that tendon, and then sudden forceful contraction to the plantar flexor muscles, which is just a common trigger where the forceful contraction of the plantar flexors, especially when it's in dorsiflexion. Okay, some signs and symptoms. So patients typically experience a sharp pain in their heel. Sometimes accompanied by a loud pop or crack sound with swelling and bruising. There's often a noticeable gap in the tendon and increased passive dorsiflexion. And then functionally, the injury makes walking, pushing off the foot, and climbing stairs challenging, significantly impacting their mobility and their activities of daily living. So just getting around. Okay, some testing measures. We can start with some range of motion tests and manual muscle testing, just to test the strength of the calf. Also, palpating can reveal how big the gap is between the rupture, if it's a complete rupture. The Thomas test, which involves squeezing the calf to check for plantar flexion, and this is like one of the #1 tests they do for Achilles tendon rupture. And then an MRI and ultrasound just to see how severe the tear was. Okay, so with differential diagnosis, it's essential to differentiate the Achilles tendon from other conditions such as Achilles tendinopathy, which is just like chronic inflammation, gastrocnemius tear, which affects the calf muscles rather than the tendon, and then posterior ankle impingement and calf muscle strain are also in that ballpark. And then within Achilles tendinopathy, that's been like Achilles tendonitis, tendinosis, it's a part of that. Okay, so when we get into our rehabilitation process, looking at the max protection phase, you want to just maintain the strength at the hip, knee, and core, focus on the things above it, but also managing inflammation and pain while they're in the boot, because there's no weight bearing in the beginning stage, and avoiding elongating that tendon. So interventions could be ice elevated compression, rise, do some quad sets, prone hamstring curls, and straight leg raises. During the moderate phase, you want to avoid overstretching as well. They may be in the boot, but progressing to a partial weight bearing. And then restore full range of motion and progress of strengthening. And then the interventions can consist of range of motion exercises, 4-way ankles, bilateral standing, and then progressing to unilateral standing. So basically like weight shifts to single leg. And then during the minimal protection phase, the goal is to just restore full range of motion. And during this is when you start progressing them back to their sports activity and doing more sports specific training. Okay, so our outcomes. The likelihood of a re-rupture is highest within the first year, particularly with non-surgical treatments. So within, for people who don't go the surgery route, it's a 21% chance, but people who go the surgery route, it's only 5%. And then patients can usually expect a return to full activities within 6 months, and research shows that eccentric exercises are especially beneficial for athletes recovery. More for athletes than people who aren't athletes that had an Achilles tendon rupture. Okay, the overview, Achilles tendon is a partial or complete tear of the Achilles tendon. It's usually due to sudden, high force impact on the calf muscles, commonly seen in sports like with running and jumping. Patients may hear pop or feel a sharp sudden pain. The Thompson test is the #1 special test for this injury. Maximum, moderate, and minimal protection phases start with safe mobility and boot to advancing strength training, getting them back to their sports, and they can see a recovery within 6 to 12 months, and with a possibility of a re-rupture and a reduced calf strength. And then these are my sources. Any questions? Tia?
What would you say is the defining sign or symptom to diagnose an Achilles tendon rupture?
Definitely, well, I won't say definitely if they heard a pop, but a pop is like one of the most common things that people with this experience. And I don't know if y'all seen it, but I forgot to notice. Kobe Bryant had Achilles tendon rupture on the court. I was like, oh my goodness. But it's severe pain within that ankle for sure. But you just gotta differentiate it between the other differential diagnosis and the Thompson test. Thompson test, #1.
Does it occur more with jumping or landing?
I think it said more so like stressing the impact, so I think it would be landing, because you putting that stress on that tendon in the wrong position, which causes that to kind of like snap. Kind of crazy to think about, really. That's what all these injuries are.